Heel Spur, the truth no one talks about. Introduction, a bitter pill of reality. I want to start this conversation honestly. If you're looking for a way to break the spur in one session, waiting for the name of a miracle pill or the address of a clinic with a secret laser, this text may disappoint you. But if you are tired of hopelessness, if every morning starts with you freezing at the edge of the bed, afraid to take the first step, if this knife in the heel has turned your life into a constant search for a place to sit down, then stay. We are not going to talk about advertising. We are going to talk about physiology, common sense, and how to get back your right to walk without pain. I will tell you the truth. It's not scary. It simply requires your participation, not blind faith in medicine. Part 1. An anatomical detective story, what really hurts. When a person comes to the doctor complaining about heel pain, the scenario is always the same. Questions, an X-ray, a verdict, you have a heel spur. On the image you see a sharp spike. And in your mind a picture immediately forms, this bony needle is stabbing into the soft tissues with every step. Logical? Yes. Correct? No. Here is the main truth, a heel spur is not the cause of your pain. This is confirmed by thousands of clinical studies. There are huge numbers of people who have a whole fence of spurs on X-rays, yet they run marathons and have no idea where their heel even is. And there are others whose scans are perfect, but the pain is so intense they can't make it to the kitchen. The spur is not the enemy. It is a patch. When your plantar fascia, the tight ligament that holds the arch of the foot, is constantly overstressed, the body understands, the tissue can't cope, it's about to tear away from the bone. And so it begins to reinforce this spot by depositing calcium salts there. The spur is a consequence. It is your body's attempt to save itself from a rupture. Trying to break it is like lowering a fever during an infection without addressing the virus itself. Part 2. The trap of standard treatment. Why does treatment so often give only temporary relief? Have you had injections? Shockwave therapy, ESWT? Expensive gels and ointments? For a while it felt better, and then a month or two later the pain returned, sometimes even stronger. Why? Because you were treating the heel. But the problem is located higher up. When you hit the spur with electrical current or shock waves, you traumatize an already inflamed area. The body receives a signal, this is a combat zone, we need to protect it even more aggressively. And it builds even more protection, creating an even coarser scar. The real culprit behind your suffering is tension. Your foot has turned into a tight bow, where the string, the fascia, is stretched to its limit. And until we loosen this bow, the heel will keep screaming for help. Part 3. Where the root of the problem is hiding. The source of pain almost always lies in the posterior chain of your legs. This includes the calf muscle, the soleus muscle, and the Achilles tendon. If these muscles are tight, shortened, or switched off due to a sedentary lifestyle or improper footwear, they stop absorbing shock. With every step, the impact is no longer cushioned by muscles but transmitted directly into the heel. Imagine a car without shock absorbers, it will fall apart at the first bump. Your foot right now is a car riding on bare rims. This is especially noticeable in the morning. Overnight, the fascia tightens slightly and blood flow slows down. And when you wake up and abruptly place your foot on the floor, a microtear occurs in the overstretched tissues. That microtear is the knife you feel. Part 4. A practical guide, restoring function. Only one thing works, restoring elasticity and function to the muscles. we must make the muscles work again and allow the ligaments to stretch. Precautions, important. If you are over 60, forget fanaticism. No sudden movements. Your task is not to stretch at any cost, but to give the tissues a signal to relax. Block 1, for those who find it hard to stand, 70+ option and acute phase. These exercises are done lying down, right in bed. This is your safe warm-up before the first step. 1. Gentle stretching, lying on your back, slowly pull your toes toward you. Your heel slides along the bed. Feel your lower leg coming to life. Hold for 15 seconds. Repeat 10 times. 2. Circular movements, make very smooth rotations with your feet. This is lubrication for your joints and a pump for blood flow. 3. Towel stretch, sit up in bed, loop a towel over the upper part of your foot and gently, without jerks, pull it toward you. This allows you to control the tension with your hands without loading your back. Block 2, basic level, on a step. This is the gold standard of rehabilitation worldwide. Find a stable step or threshold. Be sure to hold onto a railing or wall. Stand with the balls of your feet on the edge so that your heels hang off. Slowly, to a count of 5, lower your heels below the level of the step. You will feel a stretch in your calves. This should not be painful, it should be noticeable. Hold at the bottom for 30 seconds. Pro tip, slightly bend your knees in this position. You will feel the stretch move deeper. This means we have engaged the soleus muscle, the main silent culprit of heel pain. Part 5. An honest prognosis and strategy. How long will this take? If you're expecting results tomorrow, there won't be any. Your body has been accumulating this tension for years. After 7 days of daily practice, you will notice that the morning pain has become duller, it no longer pierces sharply. After 3 weeks, you will catch yourself getting up and walking without thinking about your heel. After 2 months, normal walking biomechanics will be restored. An important rule, if the day after exercising the pain is stronger, you overdid it. Step back and do it more gently. We are not fighting the body, we are negotiating with it. Conclusion, your body is not the enemy. A heel spur is your body's cry that it is overloaded. It is not broken, it is simply asking for help. Stop looking for external salvation in the form of expensive procedures. Start small, give your legs the attention and movement they deserve. But remember, heel pain may be a symptom of more than just plantar fasciitis. If you see redness, if the heel is hot to the touch, if you have diabetes or serious vascular problems, see a doctor immediately. Exercises are a powerful tool, but they must be applied to the correct diagnosis. Your legs have carried you for decades. It's time to take care of them. Start today. Do these simple movements right now, sitting in your chair. Your body will answer you with gratitude. What can you do right now? Try pulling your toes toward you and feel how tight your calf is. That is the beginning of your path to recovery. Take care of yourself.